Welcome back, everybody. I'm Josh Fenton. We're here at the Navigant Credit Union Broadcast Center. It is Business Monday. I want to thank Toonie for coming up from Newport, talking about the Innovation Center going on down there. Susan's here from the Walker School of Allied Health. You're an entrepreneur. You're launching a new business.
I did.
Tell us what you're doing.
Thank you for having me.
Absolutely.
I am Sue Von Villis, and I've opened up the Walker School of Allied Health, which is a nursing assistant training program. I'm located in Bristol on Metacom Avenue. My goal is to stop the need to have nursing assistants. We would like to train the employee, get the employee hired, train the student, get the student hired, and service the needs of those of the disabled and elderly in our communities.
That's great.
At the same breath, I am a American Heart Association certified CPR training center. Anyone from healthcare workers, restaurant workers, babysitters, you name it, you're welcome to come on in and get CPR certified yourself, because you never know when you need to know how to save a life.
Let's talk about nursing assistants in that industry, and it's a critical part of the healthcare industry in every state, but especially in Rhode Island, where we have an older demographic.
We do.
And there's tremendous turnover in the industry, low wages, thus not a lot of stability, because if you can get an extra $1 an hour, you jump across the street, and if you can get $2, you jump from town to town. Let's just talk about the problem. What's the flaws in? It's a major part of the healthcare system.
Eyes and ears.
Yeah.
These nursing assistants, registered nurses. I've been a registered nurse for 25 years. So having said that, working in long-term care facilities, working in the community, working for schools, working in the insurance companies,
Sure.
wherever all we can go off and work, we are tethered to the desk,
Right.
if you will, where the nursing assistants are the eyes and the ears of the operation. They're making the machine go. Unfortunately, these gals and guys are not compensated where they should be for their care that they're rendering, and care that's being delivered either in a controlled environment, in an assisted living environment, in a skilled nursing, in the hospital, or in the community. There's such a need for the staff out there. There's such a need for people to be educated and give it a chance and be able to come on out and take care of our elders and disabled in the communities. And I can't say it enough. It's a desperate need. I am located in Bristol on purpose because of the demographic. We have Little Compton and Tiverton, and on the island with Newport, Middletown, and Portsmouth, East Providence, Bristol itself. There's so many elders around, and we ultimately want them to age in place as opposed to going to nursing homes.
Absolutely right.
Only 5% of the population now is currently involved or enrolled in nursing facilities as their long-term stay. People deserve to be in their homes, and we need to have certified and licensed workers in order to keep them happy and healthy in their homes.
Why hasn't the demand of the industry, why hasn't the economics helped increase the wages and make it, to some degree, a more respected industry? I mean, we all intellectually understand the critical nature, especially if you've ever had anyone in your family who has it, but yet somehow it's on the cheap, it's lowest cost, and thus you lose a lot of people who might be really committed to the healthcare, haven't had the opportunity to become an RN,
It's really
and go
a
into
shame.
nursing school.
It really is a shame.
And they leave to, go into food service or some other, just slightly better paying industry.
Right, I know. This is a dying breed of animal, if you will. The need is so high, but people are afraid to go in and start these programs because it might cost them money, and they don't know what to do next because they might not be compensated.
Right.
The staffing ratios need to be where they need to be for Medicare. We need to have so many people on the floor at a time. The pay wage, there's been an increase most recently just last year. It all really depends if you work for a big corporation or if you work for what's called a mom and pop agency, where your pay is going to be a little bit different. Hopefully the state of Rhode Island will be able to catch up, please, and allow our service people, our health paraprofessionals, to be paid at the right wage where they should be, where they deserve to be. There's not a lot of education involved. It's not a high school, go to college for 4 years kind of situation. It is 120 hours of training. but those 120 hours of training are so vital to the survival of our people in the community and in facilities.
What was the genesis of you starting this? What took you from your previous role and said, I'm done, I'm going to make it happen, I'm going to be an entrepreneur?
Well, let's back up a second. I've been a nurse for 25 years.
Right.
And I've always worked in the community.
Yeah.
That's my thing.
I get all that, but that's a
All of
long
this,
way
right?
from
Having
saying,
said
I'm
that.
jumping in the deep end of the pool.
Right. So I taught part-time between working 2 and 3 jobs at a time. I'd work all day and see patients, and then I'd come home and I'd teach at night.
Right.
Why am I doing this? Because the product I was seeing out there of nursing assistants was just not good enough.
Yeah.
I had to put my 2 cents in to make a difference. So 13 years later, I kind of stepped back and took on a different position in my nursing career, and people were saying to me, how can my mother, brother, nephew, uncle, niece, granddaughter get educated?
Right.
Apparently, you're the best teacher they ever had, and this is where you need to be. So I think under peer pressure, I caved. I'm kidding. I happened to have a spill last winter and went down my back stairs, crutches for 5 weeks, had a little
So
bit of
much
time
fun.
on my hands
Right.
to decide what my next move was going to be. And after hearing people asking me over and over again, I started writing my business plan, and here we are.
So
I couldn't be happier.
So any failure we can blame that when you fell, it was a head injury and nothing else. So, but let's talk about it. You know, it's such a different experience of running a business. Walk through, you know, these initial months and what the experience has been. What's been the good? What's been the bad and the ugly?
The good is that, along with my nursing degree, I went to business school.
Great.
And I've got my baccalaureate in business, where I was able to know how to write a business plan, know how to approach for the Small Business Association to get my backing and do what I needed to do, but I didn't know how.
Right.
I knew the theory, the concept. Basically, I sat down and I just started calling people, and I started asking questions, and I started putting my nose in business where I
Great.
needed it to be. Having said that, I met some really great folks along the line. The biggest challenge, I think, through all of this was choosing the location of where the services needed to be delivered. There are 50 other training programs in this state that are licensed through the Department of Health. However, a majority of them are through nursing facilities. We've got a couple of private schools out there. We've got some
Right.
inactive programs out there. I want it to be an ongoing, straightforward, rotating, offering classes for the community.
So if I'm an entrepreneur at home, and I ask this functionally with almost everybody who's taken the leap of faith like you have and I have, what's
was
been
terrifying.
what's one of the most difficult components to it? What's been the most, frustrating component to it?
The most frustrating part of this is that whole rumor that nursing assistants don't get paid appropriately.
Yeah.
And why would somebody want to invest to go backwards is what people kind of think, but it's not. It's an investment in yourself. I'm promoting careers. I've made a lot of nurses in my day as well.
Right.
Not speaking over people at an educational level.
Do
where they're
your
not gonna
grads do
understand.
better than X? I mean, is there your ability to help place them, that
is.
infrastructure
It
of your
is.
network, and that gives you the point of differentiation?
The way I've got my program set up is they not only go through the training, they're exposed to multiple training sites during the program, of which 80 hours is classroom and 40 hours is in the community or in the nursing facility training. And I'm having these people, getting them hired directly from the chair
That's
in
great.
the classroom.
And on the business side, if somebody was sitting at home and saying, "God, there's such a demand. I want to be like her," what would you say to them?
Let's go.
Yeah.
I'm ready for you. Anything you need, I'm a lifetime referral. I am willing to go the extra step to make that happen for you, and we need you in our towns. We need you in our communities as certified nursing assistants, licensed through the Department of Health, State of Rhode Island, as a nursing assistant.
Almost every small business that comes on here has had a somewhat level of frustration with red tape, the regulatory structures within either the local level or at the state level. And I think we're going to hit a major innovation period in regulation in which things really get much more simplified. And I give all due respect to the folks at the Department of Business Regulation who are really striving to improve a lot of the regulatory structures. But, one time, a woman who was head of it said, there's, I don't know, there's 27 licenses a restaurant needs to have. And she said, we're trying to simplify that onto one page online. And my view is, we all know what a restaurant is. Why do we need 27? Like,
Why
wouldn't
is
there...
it so hard to obtain?
Right. Wouldn't there just be one license that has 27 components, not 27 different licenses? What's been your experience, and what improvement do you think needs to take place?
Having said that, going through, if you call red tape,
Yeah.
I think my strongest challenge was the town of which I'm located. There wasn't a checkbox for me.
Yeah, right.
As being an independent trade school. So that took a little bit of effort to get that rolling and get that going.
I'm sure they were so flexible about it.
It turned out great.
You're not on this list. You can't have a business.
Just a couple of months, we figured it out. It was no problem.
Right.
My next
We're going to
biggest-
make you check off kennel and seafood importer.
We'll figure it out later.
That's right.
I think my biggest challenge that I do have right now is once you're licensed through the Department of Health, you have to go up through 1 year of being in operation before you can reap the benefit, if you will. I would love to take on immediately the people from unemployment, people from Rhode Island Rewarding Works,
Yeah.
and be able to get these folks involved. People need jobs. I'm ready to take you on.
That's right.
However, I have to wait my tape, if
Yeah.
you will, that 1 year length of it in order to qualify for said program. So I think that would be the biggest deficit that I do have now.
That's
is
great.
the wait and the hold.
Well, listen, congratulations. Wildly exciting. What makes Rhode Island go more so than almost any other state in the country is small businesses. There's 30,000 active small businesses. There's about 40,000 registered businesses, but there's about 30,000 small businesses in Rhode Island. And it's entrepreneurs like you, and then you add another person next year, and then 3 more the year after, and
Right.
you start building scale. So congratulations on
I am
all
blessed.
the success. Stay in
you.
touch with us. Keep us up to date.
Thank you,
I
I
want to
will.
see that business application form there in your community.
And if you know anybody who would like to be a certified nursing assistant, send them our way. Or if you need to be CPR certified, we've got you covered.
That's great. Stay right here.
Thank you.
We're going to be back at the 4 o'clock hour. We'll have Gary Sass and Saul Kaplan. We'll be replaying the Patriots' blunder of the last play of the game. Actually, not. We are going to be talking about innovation in a big way coming up this afternoon, and some of the things that are going on. Uber's filing for an IPO, might buy Bird Scooter on the way in the last month of the year. But we'll have a rock and roll afternoon. Thanks everybody for tuning in. Thanks for our friends at